I want to thank the Mayon for the invitation. Today we will talk about dry eye. As we are in Dubai, and it's a well-known place for a high percentage of dry eye. So today we will talk about dry eye, not as sometimes it's a very mild, as a small cloud in the beautiful city of Amsterdam, but sometimes it's stormy and angry as a rainy day in Barcelona, where it doesn't look romantic as it looks like. So today we will talk about the case of a male, 66-year-old. He came with bilateral severe red eye with decreased vision. He was unable to open his eyes, and he was walking around with a full pack of medication and contact lenses. The symptoms aggravated, and he reached this level after a bilateral phaco surgery in both eyes. If we look to this, we can see how angry the eye is. So his visual acuity was 0.5 and 0.3 in both eyes. He was wearing a bandage contact lens. He has bilateral eyelid edema, signs of advanced MGD. You can see how severe the foamy tears on the eyelid margins. All eye margins has been distorted. So he has an inverted eyelashes that touch the cornea, and he tends to remove them manually. And when we remove the contact lens, we can see that there is, apart from severe congestion, we can see that persistent epithelial defects with fluorescein positive, and we can see that the peripheral corneal panos in both eyes. So this is a complicated case. We need to analyze it. After fluorescein, you can see that the contact lens become part of his life. He's changing it regularly, as if doing his toothpaste every day. So we need to analyze what is the problem. So in this case, we have multipathology, we have severe MGD, we have severe dryness, we have severe inflammation, which all led to the final results of corneal epithelial defect. So we need to address this pathology, and we try to give the proper treatment for each one of them in order to restore the order of the ocular surface. So we started by giving him good eyelid hygiene, doxycycline. We give preservative-free lubricant in terms of oily-based one. I started by giving Dixa-free and Vercasia. This is cyclosporine 1%, which is also preservative-free. So I concentrated on giving preservative-free medication, along with Vigamox to protect from infection, because the corneal epithelium is totally slaughtered. And also I added some multivitamins, vitamin B12 in terms of eye drops, and dexpanthenol as well. Now, by applying all of these cocktail together, we start to restore, slowly start to improve, and the corneal epithelium start to restore. The eye start to be calmer. This is the other eye, the left eye, and eventually we get it improved and the corneal healing done, and he can manage now without contact lens. He returned back to his normal life. So we want to understand this case by, of course, he's on maintenance treatment as well. We need to, after 8 months, you can see this irregular corneal surface with still angry eye. In order to understand such cases, we will thank the work of Pooja Kamar from Narayana Research Institute, which has recently introduced the concept of basal inflammatory threshold. Basal inflammatory threshold depends on the level of inflammatory molecules on the ocular surface, especially tumor nerve factor alpha and tumor growth factor beta and MBB9. So that BI threshold of the cornea is responsible of maintaining the homeostasis by affecting the corneal nerves. So if we look to that cells in the right eye, we can see how the healthy cells with normal MBB, with normal inflammatory molecules, can act normally, can replace themselves normally, and can keep the status of good homeostasis. While when we have an high inflammatory markers in the other eye, in the other photo, you can see how the cells are damaged and they are unable to renew itself and keep the normal regeneration of the ocular surface. And if you want to understand why, we need to look to the behind the scene, which is the corneal nerves. I want to thank Dr. Ayulia because she beautifully shown how in ocular rosacea and in SCV, how much the nerves has been affected. So in order to have a healthy epithelium, we need to have a healthy nerve. And that was well known from 2019, the role of corneal nerves in ocular surface hemostasis. When we have an insult to the ocular surface, like a contact lens or dry eye or inflammation, there will be an increase in the level of the inflammatory markers. And these inflammatory markers diverse the change in the nerve cell density. So the supply for the epithelium is diminished, and this is lead to the injury of corneal epithelium. And we can see here also by Dr. Boja has beautifully shown how is healthy nerves means healthy epithelium. And we can, eventually this will affect the quality of vision as well. So it is not on the cellular level, it's on the clinical level as well. And not only in the normal regeneration, even when we have surgery, that cycle of regeneration and healing process all are affected. And that's why we might get sometimes corneal haze, corneal ectasia, corneal melt and graft rejection in case we have a chronic inflammatory case on the eye. So to take home message, we need to know that the ocular surface is an integrated, complicated system which works in a harmony together. So in case we have a complicated case, we have several presentations, we need to analyze what is the pathology, address it, and treat it properly. And I do believe that a lot of research needs to be continued in order to understand the full view of the biomicroscopic interaction. Just please go to one back, the last slide. And there is in the future some new treatment coming out. So it's in case we need to look to the ocular surface as a full harmony symphony, not a solo player. Thank you very much.